Welcome everyone to this wonderful webinar with Vyla Aesthetics. We're here to announce a brand new treatment called UltraClear. This is our virtual launch event with Amanda Klatt, Megan Valverde, and Kathryn Klossner. If you have any interest in laser treatments or skin rejuvenation, we are going to explain what this laser is all about, what it can be used for, why you might consider it over other treatments, and why we are also excited for this new device. We also have a promotion, so make sure you stay tuned at the end of the webinar and we'll explain how everything will work. Before we get started, I'm pleased to introduce our speakers from Vyla Aesthetics. Amanda is the founder and co-owner of Vyla Aesthetics with more than 8 years of experience in aesthetic medicine and advanced training as a family nurse practitioner. She specializes in Botox, filler, and injectables, combining her medical expertise with techniques learned from leading plastic surgeons and top med spas. Megan is a nurse practitioner as well, and the other co-owner. She leads our aesthetic injectors, and she brings a strong clinical foundation with experience in critical care nursing and advanced practice medicine. Kathryn is a board-certified physician's assistant, specializing in hormone optimization, wellness, injectables, and laser treatments, and she focuses on helping patients feel balanced, energized, and confident. So, Amanda, please take it away.
First of all, I want to say thank you so much for coming. We're so excited to offer this, and we know that we've had so many questions about it. So we thought this was a great way to kind of give you guys some more information and kind of go talk about what the laser is, what it does, and how we chose it. So we have been looking at a new laser for a while. We felt like we were kind of missing a gap. And this slide kind of talks about why patients chose it, but also why we chose UltraClear. It's really comfortable. We normally just use topical numbing cream, and people do really well with it. I don't know if any of you guys have had Morpheus at our office, and we love Morpheus, but it's a little bit spicier. We have to add the Pronox, but UltraClear is so much more comfortable compared to that. And we know that pain was sometimes a barrier for those treatments. It treats all skin types. It treats all skin concerns. So it's kind of like an all-in-one solution. It helps with pigmentation, tone, texture, fine lines, wrinkles. It's quick and convenient. The lighter treatments, which we'll kind of talk about, are like 15 to 20-minute treatments, and then the deeper ones can be longer. But you're not gonna spend all day with us, even though we would love to hang out with you guys because we love all of our clients. And then it's nice because you can treat all areas. You can treat neck, face, we can do hands, we can do surgical scars from like breast augs, tummy tucks. So it's kind of fun that we can just do a lot with this laser. Um, and like I said, everybody is a candidate for UltraClear. It can treat all skin types, which is really cool because some lasers can't treat some of the darker skin types. And it can treat a lot of things: tone, texture, fine lines, acne scars, pigmentation, just overall skin health and quality. You guys have probably seen this if you have been in our office. We call it the Fitzpatrick skin type scale, and we just kind of rate your skin versus how fair you are versus maybe how dark. And like I said earlier, some lasers don't treat past the type 3. So it's nice that we have a laser that can treat all skin types. And also, because we have a fair amount of patients with melasma, this laser is also melasma safe, which we really like, and it also can kind of help keep it at bay. So we really were just trying to find something that could kind of treat everyone and everything, minimal pain and minimal downtime. So this is just a brief little um, picture of the skin. So the top layer with the hair in it, that is our most superficial layer. That's what the 3D Miracle is going to treat. So this laser has multiple different modes. If you watched our stories or talked to us in the office, you might be like, Ultra Clear, 3D Miracle, what's going on? It's one laser, but we can tailor it kind of to what you're looking for, the downtime you want, and the outcomes you need. So the lightest layer, the 3D Miracle, just treats the top layer. It's good for like light skin resurfacing, some pigmentation. If you have an event in like 3 weeks and want really glowy, fresh skin, this is like the perfect laser for that. It's also just a good maintenance laser to do like once quarterly just to keep your skin nice and healthy. The next one, the Ultra Clear, treats more of the epidermis, so a little bit more of the fine lines, wrinkles, where they're getting deep, but they're not, as deep yet. And then the laser coring, which is the most aggressive treatment, is treating deep down into the dermis. And that's where we're getting that controlled heat, where we're going to kind of get that the tightening from. So really deep lines is where we're going to treat the coring. The coring has the most downtime, but even with UltraClear and coring, the worst the downtime is like 3 to 4 days. You're not as much downtime as like a CO2 laser, which is really nice. Um, and this kind of, again, is just another slide to kind of help explain the different levels of treatment. So you can see that the 3D miracles are most superficial. We have the moderate treatment, more of the 3 to 5 days, and the advanced with the ultra clear and the coring, and that's 5 to 10 days. And we don't expect any of you guys to like memorize this or know this. For all of our laser, for the ultra clear, we're going to have you guys do a consult with us and we can talk about what is bugging you, how much downtime you have to give us. And we kind of tailor the treatment to your skin specifically. And this is not a one size fits all, which is really nice. We adjust the settings differently for every single patient on what you're telling us, what we see. So it's a really personalized treatment. And when you buy a package, because a package, we always, in all of our things we do, a series of 3 is the best for the best results. Each time you're going to get a different personalized treatment. We're going to see what worked the first time. Maybe we need to go aggressive in a different area the next time or less aggressive because you got such a good treatment. So it's a really fun laser because we can adjust the settings on multiple different levels to give you the treatment that you need specifically. Um, this is a fun slide because I feel like the CO2 laser is such a big buzzword right now, but CO2 laser, it's great. I'm not hating on the CO2. It's an older technology. It came around in the 90s and it still is great, but we have newer technology. The UltraClear was FDA cleared in 2021. And why I think that's important is because even though CO2 is great and it does what it says it's going to do, we can get better, faster results with less pain and less downtime with the Ultra Clear. It's a newer technology. It's a cooling laser. We'll go into a little bit more of that. And that's how we can have less downtime and just fun that it's a newer technology. Um, so this is a fun video of what makes Ultra Clear different than the CO2. So Ultra Clear makes all these individual channels in the skin, like right here. You can see the laser pulses going and in between every heat pulse is a cooling pulse, which is the blue arrow. So the cooling pulse is what makes us be able to say that is a cooling laser. There is still some heat, but that gives us the ability to control how the heat is delivered. We leave some extra healthy skin intact, and then you have less pain, less discomfort, and way less downtime. A CO2 laser just completely ablates the entire face. This is just a more controlled way of doing that, which is really cool. And like I said, it just creates less pain and less downtime. And this is kind of what does a treatment look like? These are some fun videos from when we were training and testing it out on ourselves. You can see that, we give you some eye protection to protect your eyes, and this patient is comfortable. She's talking, she's not in any pain, she doesn't have Pronox. And then this next one, um, similar, just shows that she's comfortable, she's not in any pain. You can see Kathryn going over all the areas. We do multiple passes, but people are comfortable for all of the passes. And this is a great up close video of how it ablates the skin. You get a little bit of this like grid pattern. So when you leave our office after having this treatment, you're going to have some redness, sometimes pinpoint bleeding, and you're going to see these little grids on your face for a little bit, but they do go away. But just to know for you guys kind of what to expect.
And hi,
And
Kat.
Megan is going to talk about her experience.
Yeah, so this is my experience with UltraClear. So I had UltraClear with coring, so one of the more aggressive treatments. You can see on your screen the top left is on a Thursday and the day that I got my UltraClear treatment. So you can see I do have some pinpoint bleeding, which is normal. I haven't quite started to swell yet, but I was red and hot that day. The next day when I woke up, the middle top, I was quite a bit more swollen than the day before. 4. The swelling kind of peaked, I would say, at the end of day 2. And then Sunday is the bottom middle photo, and Monday morning I woke up like that. So I actually was super surprised at how fast I'd healed. We did coring underneath my eyes, so you can see that was kind of the last area to heal. And just to share a little bit about my experience Thursday during the laser, honestly, I'm not even lying. I had topical numbing, but there was no pain. Like I was chatting the whole time. I was like, I feel some heat. The overall procedure was very comfortable, and Kathryn did a great job of making it as speedy as possible. So I didn't feel like I was, laying there and just waiting for it to be over. It was pretty quick. And then when I went home, I felt the heat start to kind of come to the surface, and I was like, okay, I'm a little hot. And that heat continued that night until I went to sleep. So I think if I had to say the hardest part of my recovery was that evening. I used a fan and a cold water soak, which really helped. I slept with 2 to 3 pillows, where I usually sleep with one, and that's to help with the swelling. So we recommend that to all patients, as well as sleeping on clean pillowcase, clean sheets, treating your face kind of like an open wound for the first 24 hours. You don't want any infection or anything. So keeping, small pets, kids away, things like that is also important to keep in mind. And then the morning after, so Friday morning, I started what we call vinegar soaks. So it's distilled water with a tiny bit of vinegar. You dip your gauze in, put it on your face, and it feels so nice. You soak your face for 10 to 15 minutes, and you can do that for comfort throughout the day, about 3 to 5 times a day, and then keep a thin layer of aquaphor on your face. And that's all I did for about 3 days. On day 4, I started to wash my face with a gentle cleanser, added in moisturizer and sunscreen. By that time, my skin had like a sandpaper texture to it. And with each soak, I was able to kind of just gently wipe away that texture, and you could see all your pigment and old dead skin come off, which is actually a really nice feeling. And then from there, my skin just looked really amazing. Some people did report some itchiness while that sandpaper textures on their skin, but I didn't experience that myself. So yeah, if you guys have any questions about actual real life healing, you can ask me, because I did it. And my skin has never looked
Also,
better.
yeah, I also want to jump in and say that we will give people in our office the aftercare. So you're going to leave with a little bag. It's going to have a bottle of normal water. You can do the normal water that day, some distilled water. It's going to give you a fan. So we're going to get you guys all set up. It's really not, it seems tedious. It's really not bad, but we're going to have everything ready for you guys if you guys come in and get treated.
Yeah, you'll get a little bag on the way out. The only thing you'll need to do is just get some Aquaphor for home. Okay, so I'm going to jump in now. Thank you, Amanda. I think Amanda did an amazing job explaining the technology of UltraClear and the reason why we chose this laser specifically. I'm going to talk about 2 of the different modes. So a little bit of the superficial modes as well as the moderate modes. So the first one that we're going to touch on is called 3D Miracle. 3D Miracle is your refreshing laser. It's for maybe our younger crowd, 18 to 40 years old. It's before an event. It gets your skin ready and radiant. There's really no pain during treatment. There's very minimal downtime, and you get amazing results. So you get dramatic results without, the downtime of everything. I would recommend 3D Miracle to people who want to improve, but also maintain their overall skin appearance. So you do, a 3D Miracle once a year or a couple times a year in between your microneedling sessions, et cetera, because it really just helps to brighten your skin and helps with that most superficial layer that Amanda was talking about. So now we can go into some before and afters of 3D Miracle, and they're pretty amazing. I mean, this is after only one treatment, and you can see she just has like a glow to her skin. It's not even, she probably looked in the mirror before and didn't think she had dull skin, but afterwards, wow, like how dull her skin is compared to after just one 3D Miracle. Another before and after, and this is an incredible one. This is after one treatment. Look at all the sun damage that this patient had. And after just one 3D miracle, so the most superficial, the least amount of downtime, she looks absolutely incredible. She looks like 10 years younger, if you ask me. The next one, so this is one of those darker Fitzpatrick types that Amanda had touched on, usually unsafe for lasers, but because of that cooling effect of UltraClear, we can treat people of all skin types. So especially the 3D Miracle, any skin type. So you can see the brightening, the overall texture tone, overall skin health has improved. Another darker skin type, I mean, she's literally glowing afterwards. It's pretty awesome. And then this is different from 3D Miracle. This is called a clear. And so clear is going to go just a little bit deeper than 3D Miracle. It's going to hit all your pigment zones. So you can see this sun damage was pretty severe. There could even be some melasma going on here. Clear is safe for melasma. And after 2 treatments, she looks incredible. Now we're going to talk a little bit about more moderate treatments. So moderate meaning a little bit deeper in the skin, a little bit more downtime. Great for age-wise 40 and above. Really good for moderate signs of aging. So your fine lines, your wrinkles, scars, acne scars, surgical scars, like Amanda touched on, your breast augmentations, mommy makeovers, things like that. Usually done in a series of 3. And the reason why we absolutely love UltraClear is it's completely customizable. So no one treatment is going to be the same patient to patient or even yourself from treatment to treatment. So we can take a look at your skin. Okay, your pigment really reacted well, but we need a little bit more tightening in this area. Or your fine lines and wrinkles really reacted well, but we still got some stubborn sunspots. So we can really customize according to your goals. And, you know, with laser treatments, the glow and the texture that you get is pretty much immediate, but results take time with lasers. Collagen remodeling continues for weeks and months afterwards. So we'll see in some of these before and afters, you know, after 3 treatments, a couple of months after 3 treatments is when you'll see the most results, final results. And UltraClear is great for men too. So tell your brothers, your husbands, your partners, your dads. You can see that this patient's treatment was customized really around his eyes to help with fine lines and wrinkles, and he looks absolutely incredible after 1 treatment. This woman, after 1 treatment, absolutely crazy in my book. I think it looks amazing. She looks decades younger. Not only pigmentation, but you can really see just a glow to her face as well as skin tightening. And sorry if you hear children in the background. Acne scars, if anyone has dealt with them, they are a pain point and they're really difficult to treat, but UltraClear can treat them. This is after 1 treatment and you just see so much improvement. Now, this neck is so crazy. This is 1 month after 3 treatments. So going back to collagen remodeling does take time. So after 3 treatments, I mean, this looks like somebody had a neck lift. It looks actually incredible, but also you can see her overall skin health has definitely improved. Now, this 5 weeks after 1 treatment, I think this woman looks absolutely incredible. And this slide in particular kind of resonates with, I think, what a lot of our client population looks like and struggles with. You know, we live in a place where we want to be outdoors, have a lot of sun damage, just like this woman. She looks like she does take care of her skin. And so just adding the UltraClear package on top of that, she looks absolutely incredible. And then this patient got so much benefit of the skin laxity and tightening, just an overall glow. I mean, her pore size, her overall skin health looks absolutely perfect, really, after 1 treatment. And this is my favorite one. So this is what I was talking about, 3 months after 3 treatments, decades off of her face, in my opinion. So they tackled everything with this: pigment, fine lines, lines around her mouth, her nasolabial folds, her under eyes. She just looks really, really incredible. And this is like a true testament of what UltraClear can really do with the customizable treatments. And next, another acne scarring one. This is after 2 treatments. So not only is her acne gone, but those kind of ice pick scars are also almost completely gone. And she has like a crazy glow. I love this one. And now I'm gonna hand it over to Kathryn. Kathryn, you're just on mute, so I would just unmute.
Hello, sorry about that. Hi, everyone. Okay, so I'm going to get into more of the aggressive side of this laser, the coring. This is for targeted areas, so crow's feet, upper and lower eyelids, nasolabial folds, around the mouth, jawline, and the neck. So it is more aggressive, but it is offering more deeper results as well. Okay, so this video is kind of giving you an idea of what exactly the laser is doing. So it's creating microchannels in the skin, which is essentially tiny, tiny micro holes that's helping bring the skin together and allows for that skin tightening. As you can see with that little floral pattern the laser created, it's more controlled, which causes less discomfort, less downtime, and kind of like you saw when Amanda was going through it, through these, you're still getting the hot and cold side of the laser as well. And then this is more for those deep acne scars, deeper lines, more of the skin tightening side of things. This is a really impressive before and after on a number of levels. She has great skin tightening, especially around the mouth, the nasolabial folds. This one's actually my favorite before and after. She looks like she had a neck lift as well. She had such amazing results in just one treatment. Like my colleagues have talked about, your results aren't instant. You get more and more collagen remodeling over time. And as you can see, 5 months post-op, this patient looks like she had a surgical procedure. Her jawline is more defined. Her neck has less fine lines and wrinkles and less sagging as well. Okay, this one is also super impressive. Her deep, deep wrinkles have been softened, almost non-existent in some areas. Also, just 6 weeks post one treatment, which is incredible. She has less deep nasolabial folds. Her neck has a lot of tightening, and is really impressive as well. This one is a lot of, I feel like a common concern with almost all of our patients is those lines we get around the mouth. We can have them at any age. You don't have to be an older patient. We get them from straws, genetics. A lot of people call them smokers lines, but her results in just one treatment as well are really impressive. She got a lot of skin tightening, a lot of smoothing from it. Her jawline looks more elongated and smooth. She has less of the dimpling that her wrinkles were causing before. Another impressive visual of the fine lines around the mouth that we can really heavily target. She had a lot of less wrinkles around her mouth where her corners of her mouth downturn. You can see that her jaw again is also more straight, elongated, has less of that sagging and gel-like texture to it. This patient obviously got a ton of different benefits from it. She has more glowy skin. Her hyperpigmentation is virtually gone. She has more definition, glow. Her skin looks more full and supple. You can see the softening of the lines around her mouth as well as on her jawline. Her eyes look a lot less sunken. They look more full and smooth. This is also a really neat result of what it can do for our under eyes and upper eyelids as well. She looks more well rested in the photo, just 2 months post-op. Really nice softening to her hyperpigmentation. She looks all around more youthful and healthy and has that glow.
Amazing. Thank you all, Amanda, Megan, and Kathryn, for this wonderful presentation. Everybody, thank you for joining us tonight. And as we mentioned at the beginning, we do have a very, very special offer. So as you know, if you're familiar with Vyla Aesthetics, we don't often discount much, but we are very excited about UltraClear and have decided to offer a 20% off discount for all UltraClear packages. And we will require a $500 deposit, and you can actually do that directly through the QR code. But if you're on a computer, we are also, or your phone rather, I'm going to send the link in the chat. So you will also be able to grab the link from the chat if you want to go ahead and book. What we're asking is just to book by June 1st. So that's just a couple of days from today. It's crazy. It's almost June. And you can actually book the $500. It looks like a gift card, but it's a $500 deposit that will go towards your package. And then during your consultation, we'll talk about what package would be best for you and also issue that 20% off offer. And the team here has been so excited about UltraClear that we are also going to be raffling off one 3D miracle treatment to anyone who puts their deposit in by the 1st. All right. And we do have a couple of questions coming in now as well. The first one here, any issues using UltraClear if you've had Botox or filler in the past?
I can answer that. There's no issues. We always, especially for filler, I would say do the Ultra Clear first and then do some filler on that end. But if you have old filler or you have filler in your face, it's totally safe to get Ultra Clear. We would just want you to be like 2 to 4 weeks out. Same with Botox, but it's not going to hurt anything you have. We're not going as deep, especially when, a lot of our patients have gotten cheek filler. Cheek filler is down on the bone and Ultra Clear, even though we sometimes with the laser coring go deep, it's still in those layers of the skin, not quite as deep as where some of the filler would be placed.
Okay. And another question here about how long we would see results or peak results from an UltraClear treatment.
I feel like peak results, especially after you do, it's recommended to do a series of 3. It's going to be about 3 months after the third one. But kind of like you saw in a lot of the before and afters, people were seeing some really good results even after one treatment. And like the tone texture, that's going to come a lot quicker. But a lot of those like deeper fine lines and wrinkles, that's going to be closer to like the 3-month mark after the third treatment.
Mm-hmm. Great. A quick question here, like housekeeping. Do we need to use the package in a certain amount of time? Yes, but you have 12 months to use the package. And there's a question here about how much a series of treatments is, and obviously if it depends on which level that we talk about.
I can take that question if you want. So we have different pricing based on the different levels. So a package of 3D miracles, for example, is $2,000. The clear package of 3. So if you remember from the presentation, the clear is a little bit deeper, really good for pigment, 2,300 for a package of 3, and then ultra clear. So your deeper settings is going to be a package of 3 for 5,100. All of those prices discounted by 20%. So for example, on the 5,100 package, you'll save $1,020 if you make a deposit or prepay by June 1.
Perfect. Thank you. Can we also talk a little bit about aftercare? We had mentioned that we're a kit, maybe they need some Aquaphor. Can we dive into what's in our aftercare treatment kits?
Yeah, I can talk about that. So for aftercare, the first day, we're really not doing anything. You can do some just water soak. So we're going to give you a bottle of water, so it's good, clean water. We're going to give you some gauze. Starting day 2, you'll start with the vinegar soaks. We're going to give you a bottle with distilled water and distilled vinegar with like the right ratio in it and some gauze to kind of get you started. That bottle should probably last the entire time. You don't, a little bit goes a long way. You just put it on the gauze and put it on your face. You do that for sure for the first like 3 days. After that, a couple of people have told us that they keep doing it because they like the way that it makes their skin feel, and it kind of helps, like Megan said, helps some of the sloughing kind of come off. But after 3 days, you don't have to do any more soaks if you don't want to. also in between like the vinegar soaks, you're going to do a very thin layer of Aquaphor. So it just looks like your skin is kind of wet, but not goopy. We just want to keep the skin hydrated. We have that new fresh baby skin, we've ablated all the skin on top. So we're just trying to protect that while the newer skin is coming through.
And a pro tip for the distilled water with the vinegar is keep it in your fridge because when you feel that heat, it feels so nice coming out
Yeah.
of the fridge. So I was taking like the bottle, putting it in a clean bowl, like a little bit, and then dipping my gauze in that and keeping the bottle in the fridge.
Good
We're
idea.
also gonna give everyone like a fan. After I had mine done, during it I was fine, and then after you do start to feel hot, and so for like 2 hours I was like walking around with this fan, and it felt really nice. So we're giving everyone a fan because it's just a nice little added perk. But I would say after like 2 hours, most of the heat goes away, and even though the pictures look a little scary, like Megan's progression, usually by the next morning when you wake up, you don't really feel like you feel
Hmm.
swollen, but there's no pain. Like you're not uncomfortable, and you do those soaks and it feels really nice, but there's not like a lot of pain, even though it looks kind of scary.
Hmm. Agreed. Yeah, the heat dissipates after that first day. A couple of other questions here. What's the difference between an ultra clear and a BBL or Moxie treatment?
I can answer this. So BBL and Moxie are great treatments. BBL is really just for like your colors. So reds and browns. Moxie is a very light resurfacing laser. So you're kind of like limited to what you can do. So Ultra Clear does all that and more because you're really getting more corrective results, especially with that laser coring. So,
Hmm.
we would be remiss to say we didn't think about a BBL and Moxie, but when we looked at UltraClear, the option was pretty clear. Like UltraClear just does more, so we can offer more.
Okay. We talked a little bit about Botox already and getting it if you've had filler before, but can you do Botox and ultra clear on the same day?
I would say no, just because we would have to do it after. We wouldn't want to do it right before the laser. But after your skin, we've just ablated it, so it's not a great idea to stick a needle into it. But, you could come 5 days later and get Botox or 3 days, when you're feeling better. But I don't think anybody wants a needle stuck in their fresh, very
Yeah.
sensitive skin after we've been lasering it.
No, definitely not.
Yeah, and like
Um,
speaking from experience, like if you need that Botox, like I could have done it like 3 days later. I would have been like, okay, I'm ready.
yeah, good point. All right, another question here. Can you use different settings in one treatment, like laser coring around the mouth, less aggressive other areas?
Yes, that's why we love Ultra Clear. So, for example, my treatment that I got, Kathryn was like, "What are your concerns?" I was like, "My under eyes, my nasal labial folds." So she only did coring in those areas. So we would never core an entire face. Coring is really just reserved for those tricky areas. Um, Along the jowls, for example, and the neck as well, but you wouldn't core someone's entire face. So back to kind of like customizing the treatments. This might be in the weeds, but like for me, I did coring under my eyes and my nasolabial fold. Then Kathryn did a passive ultra over my whole
Hmm.
face and my neck. So I get those fine lines, wrinkles. And then she did a clear over my whole face and neck to clean up the pigment. So it is completely customizable.
And I'm just gonna
Amazing.
jump in. So if you buy the Ultra Clear package, all of that is included. Like you are getting as many passes with the different settings that we feel like you need. Like if you
Hmm.
need coring, we're gonna do that, and the Ultra and the Clear, all the different ones, each treatment. So you're not gonna be, it's not like, oh, I bought this, but I don't get this. So when you buy the Ultra Clear package, which is kind of like our higher level, like you're getting um the full laser to like what we can do and what we think is good for your skin.
Hmm. Thank you. There's another question about how much time is necessary between the series, right? Like we're suggesting the packages are 3 treatments. If is someone getting like 3 laser corings, how much time would we do in between those?
So we recommend a minimum of 6 weeks. So I think 6 weeks is the sweet spot. So you can stack them on top of each other like that. So package of three, 6 weeks in between each one. Just keep in mind if made the deposit or paid for the
Right.
package, you do need to use the entire package within a year. just for, our books and everything, just make it a little bit easier.
There are a couple of questions here too, if they can get a package of two or if it's probably like more than likely always three. Any thoughts there?
I can answer. It's always three. There's just been like a lot of studies, even with, IPL, we recommend just the way that like our body remodels collagen and does it. It's a pretty long process, and that's why you see the best results in some of these like the 3 months after the third. It just takes a while, and especially when we're trying to do pretty corrective work, three really is the sweet spot. And like Megan said, you might not do laser coring every time, or we might do more aggressive coring the first time and not the second. But to get like the results and the remodeling, it does take the three, which is why we sell it in the package of three.
Perfect. There's another question about microneedling, RF microneedling compared to UltraClear. Can you describe the differences there too?
I can talk about that too if you
Oh,
want.
you can go, Kathryn.
No worries. So the RF microneedling is the needles going in. They're heated needles that are going into the skin. It does offer tightening because of the heat, and it does help with collagen remodeling. However, the depths are a little bit different, as well as radio frequency microneedling doesn't necessarily target hyperpigmentation. It can help with it, but it's not the main purpose. Whereas this machine, our laser can do a lot more things, and we can change how deep or how moderate or easy we go with our settings.
The other thing too is that microneedling, the RF microneedling, because we have Morpheus and we love Morpheus, and this isn't necessarily taking place of Morpheus, but it doesn't do any skin resurfacing versus this one also does the skin resurfacing. So yeah, like Kathryn said, the RF microneedling is really great for collagen remodeling, but this does that and some other things. So it just depends on what you're looking for.
Okay, perfect. The last question I have in here is again like housekeeping about the offer. So if we do the $500 deposit by the first, asking when the balance that would be due on the remaining amount. Is that at the time of your first consult?
Yeah. So at the time
Okay.
of your first appointment, because you'll pay and then you'll have to come in. Like I said earlier, we do consults for all of our UltraClear patients because we want to, give you all the right information, make sure you have the pre-post care. And so then we'll schedule after the consult, we'll schedule your first appointment and it will be due at your first appointment.
Great. Thank you. All right. Thank you all for coming tonight. We appreciate your time. Megan, Kathryn, Amanda, you did amazing. Thank you for sharing all of your UltraClear knowledge with all of us. As a reminder, please use this link here to to purchase your $500 deposit. That will get you the 20% off. And then by early next week, we should have our 3D Miracle raffle as well. So we'll let you know who wins that, which also can be used on your neck or your hand. So we're super excited about seeing some additional results off the face as well. Anyway, we'll send follow-up emails out to everyone tomorrow. Please message us if you have any questions in the meantime. We'd be happy to help. But thanks, everyone. Have a great night.